All right. Hey, everybody. It's Allan Acton, and I'm excited to be here with Adriel Tomek today. Adriel is a physical therapist and clinic director with Results Physical Therapy here in Raleigh, North Carolina. And I want to talk to you today a little bit about like how people can use a physical therapist that maybe they're not familiar with, or some things that they can learn from you that they can use on their own at home. But first, talk to me a little bit about growing up, because I think you told me you grew up out west and your parents were huge skiers. Is that right?
Yeah, so thanks for having me. Yeah, I love being a PT, so I'm excited to talk about that today. I grew up in Michigan, but then was out west for a while. My parents are big skiers. They live in Park City now, which is super fun because I can go visit them. But yes, we at Results PT, we see a lot of patients for a lot of different conditions, but I think the things I see people the most for are low back pain, headaches, neck pain, ankle, knee injuries, things like that, mostly orthopedic conditions.
Right. Yeah. So one of the things that's happened lately, I think, is physical therapists are now able to see patients without having to go through their orthopedic surgeon. And I remember growing up, like if I had something going on, it was always a referral to the physical therapist, and then they would do it. But when did that change? And I think that the training changed for you as well. Can you talk a little bit about that?
Yeah, so now we have doctorates of physical therapy, so DPT, lots of fun initials after our names now. That comes with a price tag. Yeah. But yeah, so I went to Northwestern University to get my doctorate in Chicago, and then the laws changed in the last decade, or last 2 decades really, but in North Carolina to allow for direct access to, you don't need a provider's script to access physical therapy, which is great because it gives patients a direct route to get to PT without needing to set up an additional appointment. So our doctorate allows us to screen for medical complexities, different issues that might come up that could warrant a referral out. So we have the skills to determine if you need to go see your provider. But yeah, it opens the door to patients to have a direct route to PT.
Got it. All right. So we'll come back to that in just a second. But tell me a little bit about how did you end up wanting to become a physical therapist? Like, what was your motivation for that? Like, what other things had you considered? And then what was like the defining moment where you're like, all right, now I've decided to go to physical therapy school?
Yeah. I always loved sports, so I had exposure to PT as an athlete, and a few injuries brought me to PT myself. And then I really thought I wanted to go the route of nursing, did that for a while as far as like shadowing and volunteering to get exposure, and then decided that PT was the way for me to go just based on like meeting the PTs in the hospital setting. And then I found my way to the outpatient orthopedic setting from doing more volunteering and shadowing and just getting some hands-on experience. I think it's really cool to see the progression of the patient from initial visit through meeting their goals. So usually we'll see patients for about 6 weeks, and a lot can happen in 6 weeks, like getting patients back to what they love to do. And I think just seeing the patient from the beginning to the end really inspired me to want to help more people. Getting out there and trying to get patients better and back to their daily activities was a huge motivator for me.
Yeah, that's neat. One of the things that I like about being a dentist is being able to see the changes in people relatively quickly, and to be able to see somebody get better in physical therapy in 6 weeks. I've seen, definitely some overlap that we'll see at our practice. Somebody comes in and maybe they've broken a front tooth or they don't like the way their teeth look. And it's a different type of disability, of course, but, they don't smile in pictures, or they'll be in a group shot and they'll be like, I just feel like I need a change. And we can take them from being self-conscious about their teeth and holding back their smile, and then relatively quickly being able to see that change. And I think, like you, that's one of the things that I like about my job the most, is being able to make those changes in people relatively quickly. And you feel like, at least for me, when you take somebody who has been self-conscious and maybe they don't smile, people perceive them to be a little bit different, right? They'll be like, he's kind of grumpy, or he doesn't smile. And then you take them and you're like, now he smiles more and he's more interactive with his work colleagues. And if people perceive him differently, now he's more fun. And so in some
Yeah.
small way, like for us, that's how we're changing the world in like really small doses. So, and like for you, do you kind of feel the same way? Like when you take
Yeah.
somebody and you're like, all right, now I've taken them, and maybe you have some examples of somebody where you've been like, this person, like they couldn't walk or they really had trouble with their back. And what were some of the things that maybe a success story that you have for that?
Yeah, and I'm sure you've seen this too in your practice where like pain changes people. Like pain, it's so difficult to deal with that it can literally change your personality, you know? So
Yeah.
you see people come in and they are grumpy, you know, they're
Yeah.
not pleasant to be around, but it's up to us to be there for them and to make their lives better. So seeing those painful patients where their personality just did a full 180, you know, from the first day to the last day where they're wanting to give you a hug when they leave. It's like,
Yeah.
oh, you really were not happy with me the first day
Yeah.
when I made you do all these movements. But the last day, watching them like walk out and feel so proud of how far they've come in 6 weeks, like it's really cool to see that change in personality and to see that what you're doing affects their lives on such a deep level because they then feel like they can get over obstacles and they can confront things in their daily life too. So I've had a lot of success stories. Gosh, let me think about that. I feel like I have some good ones I could draw. Yeah, I think so. One of my most recent success stories was a young kid who had Achilles tendonitis and he was out of sport. And like for a 12-year-old boy being out of sport and not being able to do the things that he can do to interact with his friends and to do age appropriate things, that was pretty debilitating for him. So first just getting him back to walking comfortably and then getting him back to participating in sport, it was really cool just to see him like be more engaged in the clinic and be excited to do different drills. You know, the first few days of PT can be pretty boring because you're in a lot of pain and you're just doing the basics. But then the next few visits, you get to do more functional things. You get to do more jumping. You get to do more bounding, more sport specific things in his case. And I think just seeing him evolve was really cool. And then after he like had a few practices, he came back to us and he was like, I did it. And he got to ring the bell and everything. So it's always cool to see that.
Oh, that's great. So, and now he's back into sports again, right? And he's giving you high fives and ringing the bell. Yeah, that's great. What else? What other stories do you have? And like, so talk to me maybe a little bit about like, what are some of the common things that people come to see you for? And then maybe some of the things that people don't know that they could come to see you for that you could make a difference in.
Yeah. So I think one of the most undertreated populations is fall prevention and balance for older patients. So there was a really cool study that came out in 2022 that kind of broke the ground as far as like balance studies in PT goes, because they found that patients that cannot stand on one leg for 10 seconds have a higher risk of mortality and of a fall in the next 10 years. So the study basically showed that a very quick test of can you tuck your opposite foot behind your knee and stand on just that one leg. So if you're standing on your right leg, can your left foot go behind your knee? And can you stand on that right leg for 10 seconds? They had 3 chances to get that right. And it was a very clear like pass or fail. And in the study, if they couldn't do 10 seconds on one leg, then they went into the fail bucket. And it told us a lot. And these were patients like 40 to 65, I think, was the age range. But it allowed some insight into some simple tests that we can do to predict things like that. And it also showed that the better your balance is, the better your decrease in the fall risk is. And it actually decreases your risk of mortality in the next 10 years, which is pretty huge. So balance matters.
Right. And I mean, you hear things like if you break your hip, like there's a high chance of mortality in the, in the not too distant future. Right. And so like being able to maintain your balance and not fall down with that is like an easy way to help stop that. So you're talking about a test that sort of can indicate that, but let's say that somebody is at their house and they try that test and they're like, oh, well, I can't quite do the 10 seconds. What are some things maybe they can do at home, or like can you just call up Results Physical Therapy and say, hey, I'm struggling with my balance. Can I come in and go through a few sessions and you can teach me how to do it and you can teach me how to get better at it, and then like actually see some progression and then track it? Like there's a lot of things that I feel like I could be better at, but it's almost like I need a coach, like
Yeah.
we all know how to get a six pack, but it's like,
How do you do it safely? Yeah.
right. Yeah. How do you do it and stay motivated and stay on track and do the things that you need to do? So are you able to, like, because we have a lot of patients who are over 50, right? And a lot of the conversations now that I'm over 50 that we're having is all about like some of our aches and pains that we're having, or little things that are bothering us, or little like itises that we might have. And it would, and sometimes we don't quite know, our general physician can't help us, and the orthopedic surgeon's not going to help us, but are there things that we could do at home, or things that we could call you for? Does that make sense? And
Yes.
yeah.
Yes. Well, I think even the little things need treatment in a lot of cases, because what happens is we let things snowball into bigger things, and then they really restrict our lives. So I think even the smallest itises need help.
Okay.
And sometimes it may just be a few sessions of physical therapy and then you're on your way. But the nice thing about going back to your question of like where do you need to be in that range to seek care, I think we can always do standardized testing in PT and say, okay, you're in the normal limits or you're just shy of the normal limits. These are your impairments that we should work on, and these are the goals that we'll set based on those impairments. So I think even in the little things, if we can catch them sooner versus later, can really help to improve quality of life and reach goals and make sure that you're functioning at a high level.
Yeah, you bring up a good point. I mean, it's like, how many things do we go on a regular basis to our doctor for, right? We have regular screenings for, we go to the dermatologist or we get our blood pressure taken. But if there's some studies that show that fall risk can lead to mortality, maybe we should be doing screenings earlier. Right. And maybe we should add that to the list of things that we should be doing. So how often, like, is that something that you can do, or is that something people actually come and see you for and say, hey, let's go in and do like a comprehensive, where am I weaker than I need to be?
Yeah, I think that brings up a good point, because we can do what's called like a free screen, basically, where patients will come in and we'll do an assessment to see, like, do you qualify for PT? Is this something that is treatable? Is this something that should be treated? Or is this something that you can do a few things on your own for at home and work on some slight unbalance or some slight like disequilibrium? So some of those like little tricks that I love to give patients at home are, can you stand on your one leg and brush your teeth in the morning?
Okay.
Like, you're in a safe place. You have the countertop just in front of you. If you're willing to challenge yourself and you think it would be a safe situation, can you start to implement those small things into your daily life and improve your balance just by adding in a few things that here and there, where you don't have to stop and take 20 minutes out of your day to do exercises?
Right. Yeah, like the little things that you can do to make a difference. I know I have a friend and he's like, I always put my socks on by standing on one foot. And I was like, I don't usually do that. Let me try and do that. And then so I like, let me get better at that. And so that seems like another balance thing that you get better at. And you've been my physical therapist in the past, and one of the things that you've said was really work on your glutes. Right? Like working on your lower body strength is one of the keys for that. Are there what's a simple thing, maybe like a 5-minute thing that people could do every day? Like, do they need to do 25 body weight squats? Well, like sometimes it seems overwhelming when you think, I don't want to go to the gym, or I don't want to do these things. But like, what are some things that people could do relatively easily at home that would help gain their balance back and get them back in shape?
Yeah, that's a good question. I always love to make things patient specific, of course, and evaluate the patient and make sure I'm giving them exactly what they need.
Yeah.
But I also am the queen of doing like some simple little things to improve your daily life. And in general, we as a population have weak posterior chains, meaning our back, like our glutes, the buttock muscle, and then our posterior shoulders. So like pinching your shoulder blades together, that area is generally undefined in a lot of people, and we are sitters. We are a population of sitting, so we do a lot of things throughout our day that's forward flexion. So we really need to strengthen posterior chain. That's kind of a global catch-all for most people right now. So the simple ways to do that, I love talking about posture and ergonomics with patients. So doing a simple shoulder squeeze, like pinching your shoulder blades together as if you're bringing your elbows together in the back, that can be a great reset. So no one is expected to have perfect posture all day, every day. I feel like that's a very unrealistic goal. But if you can just do 10 shoulder pinches whenever you notice that your body is falling forward, I think that's a nice reset. Or even just 5. Really, it could be as simple as 5 pinches just to activate those muscles, those stabilizing muscles of the posture. There's some cool facts about posture. One is surprising. It's that let me get this right. For every inch your head is in front of your shoulders, your head gains 10 pounds.
Like lean forward, yeah.
Yes.
Like it feels like it's like holding on, like it's like out over.
A 12-pound head is normal, but if your head is poking 3 inches in front of your shoulders, which is forward head posture, then your head weighs 42 pounds. So it puts a lot more strain on the neck muscles. It can create headaches. It can create neck and upper back pain, a lot of abnormal tension in the muscles. And that's just not how we're designed to be. Our head is designed to be stacked on our spine. So it's important that we do these little activations, like these little shoulder pinches, just to wake up those muscles that support our head and our upper back.
Right? Oh, that's great. All right. So in our neighborhood, we have a ton of people who walk. We have a walking neighborhood, right? And one of the things I've seen people wearing lately are these weighted vests to add weight and hopefully strengthen. I guess the idea is that it helps strengthen the bone, and then it makes it a little bit heavier, so it strengthens your muscles as well. What do you think about the weighted vests?
That's a good question. I don't know that I have a great answer for that because I want to look at the research. I think this has actually been a popular thing to talk about on Instagram lately.
Okay.
And I've not read the research on it, but I know people are super passionate about it, and I don't actually know the answer. I should look it up though.
Yeah. All right. Yeah. I mean, it's interesting. I mean, I wonder if there's any downside to it. Does it?
I know it loads the spine in an axial way, so I'm sure that it does help to increase bone density. I bet there's some research out there that I just am not familiar with, but yeah, I don't want to say it. Like, I don't think it's a gimmick, but I think it's probably helpful for the spine. Yeah.
Very cool. And then from a dental perspective, let's talk a little bit about jaw pain. Like a lot of the patients that I see, and what I see is, and I don't know if this is how you see it too, but most of my patients with jaw pain, they tend to be, this is a generalization, but it's usually women from 20 to 60 tend to be the majority of the people that I see with jaw pain. And the way that presents, a lot of times people will, dentists will look in the mouth and they'll see wear on the teeth. But because teeth don't grow back, you don't know, did that wear happen last week or 15 years ago when you were going through a more stressful time? So I oftentimes will look for symptoms and what kind of symptoms are you having with this, with your jaw? And that often presents as pain in the masseter muscles here on the side of the cheeks, and then even headaches that you get headaches. And that, a lot of times that happens in the morning when you wake up. You're like, I got a headache, and then sometimes people feel like they clench their teeth even during the day, and they can even get joint pain up in the joint. So for us, a night guard often acts as a way to break up the muscle tension at night, so you're not putting so much pressure on the teeth. But I also have success sending patients to physical therapy. Can you talk a little bit about maybe how you would treat that and other things to do? And you may not, this may be crossing over into something that you're not too familiar with, but we also find that people with sleep apnea are grinding their teeth more. I'm not sure if you're too familiar with that, but it's interesting that there's some crossover with the sleep apnea and the grinding of your teeth and how you feel when you wake up.
Yeah, that's a really good question because I feel like jaw pain is a very common but undertreated thing, and it can increase under stress. So cortisol is our stress hormone, and it can house itself in muscles. So muscles like the masseter, muscles like the upper trapezius, that kind of can play together in creating pain in the jaw, headaches, pain in the neck and in the temporal region or the orbital region, like behind the eyes. That is a very common thing that's generally undertreated. So I think it's good to talk about. There's a lot that PT can do for jaw pain. One treatment that I especially like for jaw pain is dry needling. So dry needling, specifically the masseter muscle and the lateral pterygoid, which is a deep muscle inside the jaw, and then working on the neck and posture. Because with forward head posture, we get a retraction force at the jaw, and so it puts a lot of stress on the joint of the jaw. And a lot of people don't know this, but there's a disc inside the jaw itself, and that can sublux or move around more than it should. It can cause clicking, it can cause popping, it can cause pain, lock jaw at the actual like TMJ. So changing the force on the jaw, decreasing tension can be super helpful. One of my number one exercises for patients that have jaw pain is clucking. It sounds silly, but clucking, like clicking your tongue on the roof of your mouth, gives a quick stretch to those clenching muscles to help to decrease tone in the muscle. I'll also teach them resting posture of the jaw. So if you put your tongue on the roof of your mouth behind your two front teeth, that allows these muscles to relax, these clenching muscles, and it decreases tone of those muscles so that we're not constantly bearing down on the joint or clenching down on the teeth.
Very cool. And you'll see success with all this.
Yeah. So we'll do other things like posture training to help to correct the whole area. So the cervical area, the spine, increasing muscle strength through the shoulders. That's always really important for jaw pain. And then we'll do some retraining of the jaw muscles. So different exercises to add in stability to the joint.
Very cool. Well, this has all been great. I think I've definitely learned a lot about different ways that I could be doing some things differently. But what else should people know when it comes to physical therapy about maybe some things that they didn't know or some ways that you can help them out?
I think one of the biggest things is just knowing that the access is there. Like you mentioned previously, like we are in a direct access state of North Carolina, so you can come straight to PT without seeing a provider. And I think seeking PT is always a very conservative approach. You know, there's no side effects to doing physical therapy like there would be if you were to take medications or anything for pain. We would be addressing the problem, so the root of the problem versus like a medication, which may just kind of cover up the problem. So I think it's important that people know that it's very accessible and there's no negative side effects besides being sore from doing exercise.
Right, yeah. I mean, I think it's a great point. Like, I really like the idea of adding in physical therapy, like a screening at some point intermittently with the type of other screening that we might do, you know, with our doctors, right? Like, whether, like I said, dermatologist or whatever. So I do think that is neat. And, you know, my mom, she can get up and down off the floor and like play with the dog and the kids, and really proud of her for how well she's maintained her balance. But, you know, with other folks, we see that as they get older, they start to lose that balance and they start to lose that tone. And if you can get ahead of it, and you probably need like a 10-year window, like, what you want to be doing in 10 years, you need to be working on now. So you don't end up with these, knee pains or jaw pains or, other pains that keep you from exercising. And I don't know, that's just kind of my takeaway. I don't know how you feel about that.
Yeah. First of all, that's awesome that your mom can get off the floor so easily, because that is also a predictor of longevity. So they talk about like blue zones in the world, and there's a population in Asia that can get off the floor generally without using their hands. And they are above 90 years old, which is just like so impressive to me.
Yeah.
Yeah. So they sit on the floor often. So they are used to that. So that's a predictor of longevity. So that's really cool for your mom.
We with the kids last year, I would do this challenge for them where they would stand up and then sit down crisscross applesauce style. And then from that same position, get up without pushing on the floor. And the kids can do it just fine, right? And then I was like, let me try and do this. And I worked on it for a while. I couldn't do it, but I think that's that predictor you're talking about is being able to do that motion is I don't know why that works. I guess it's because you've developed all your muscle tones and all the stuff that we talked about before to make that work. But
it's a
simple
perfect
test.
mix of mobility and strength. Kids still have great mobility and they generally have good strength to body ratio. And at some point in our lives, usually around the decade of age 40, we start to lose mobility, as in our muscles get tighter, our hamstrings get tighter, our low back gets tighter. So it's important to counter that and to maintain mobility and have that good balance. It became a cool TikTok challenge at some point. Getting off the floor.
Yeah. I got to work on that a little bit more, I think. So this is great. Well, this is great. All right. So how can people find you if they want to come to your clinic? How many clinics do you have? Where are you located? What's the best way to say, how do you hit the easy button to get up with you?
Yeah, good question. So Results Physiotherapy, we have about 15 clinics in the Triangle area. So lots of accessibility. I'm at the Village District, so on Oberlin Road. And then you can just give us a call. You can look us up on Google and call. If you have any specific questions, you can email me. My email is itsmeyourpt@gmail.com.
Okay. We'll put that in the show notes. So if anyone has
specific questions, they can always send me an email if they're curious if they're a good candidate for PT or if they are interested in some sort of like ergonomic assessment. I can always provide that. I think that's a helpful way to make sure that your daily habits are good.
Oh, this is great. This is great. I can see where this would be definitely really helpful for a lot of folks. And I know you've helped me out quite a bit as well.
And you're a very good patient, Allan. I will say you're very compliant with your homework. So that always helps.
I try. And
you're not afraid of dry needling. I think that's important.
The dry needling has been really helpful. It's like a cross between acupuncture and trying to get you feeling better. So this is great.
Yeah, it's like I've never been kicked yet so far from dry needling someone. It's generally been very, very helpful for people. I think a lot of people are fearful when you say needle, but when they know that the benefits are so good, it's doable.
It definitely makes a difference. Well, this is great. Well, thank you so much for taking the time to do this today. I think a lot of folks will get a lot of value out of this, and I will definitely be seeing you again soon.
Cool. Thanks, Allan. Appreciate it.
Thanks.